It shouldn't surprise us that heart disease is still the leading cause of death, especially when our diets are becoming increasingly stripped of the essential nutrients our bodies need to fight oxidative stress, regulate blood pressure, and keep our hearts beating strong. For seniors, this nutrient gap isn't just inconvenient, it can be deadly. Even seemingly small deficiencies can quietly raise the risk of heart attacks, strokes, and other cardiovascular problems. In today's video, we're uncovering the top 5 nutrients that seniors most commonly don't get enough of, and explaining how these gaps can skyrocket your risk of serious heart problems. Knowing these could literally help you protect your heart and live longer, healthier years. Before we start, please hit that like button and subscribe to the channel to help the video reach more people who will benefit from it. Let's dive in. Fiber. You may not think that fiber is among the nutrients that many seniors don't get enough of, or that inadequate intake can increase your risk of heart disease, but the truth is, fiber plays a crucial role in keeping your heart healthy. Many older adults fall short of the recommended 25 to 30 grams per day, partly because meals become smaller, processed foods dominate, and fiber-rich foods like fruits, vegetables, whole grains, and legumes are sometimes avoided due to digestion concerns. Fiber helps lower cholesterol by binding to it in the digestive tract and removing it from the body, which reduces LDL or bad cholesterol, a major contributor to atherosclerosis and heart disease. Research published in the Journal of the American Heart Association found that higher dietary fiber intake is associated with lower rates of coronary heart disease and cardiovascular events. Fiber-rich diets are also linked to better blood pressure control, likely due to improved blood vessel function and reduced inflammation. Without enough fiber, seniors are at higher risk for hypertension, heart attacks, strokes, and other cardiovascular problems. Beyond heart disease, fiber plays a critical role in regulating blood sugar. By slowing the absorption of sugar into the bloodstream, it helps prevent spikes in blood glucose and insulin. This is especially important for seniors, as insulin resistance and type 2 diabetes are strong risk factors for cardiovascular disease. A meta-analysis in The Lancet showed that high fiber intake was associated with reduced risk of type 2 diabetes, coronary heart disease, and stroke. Fiber also supports a healthy gut microbiome, which produces short-chain fatty acids that reduce inflammation and protect the cardiovascular system. The good news is that adding more fiber doesn't have to be complicated. Legumes like lentils, chickpeas, and beans can be added to soups, salads, or main dishes. Even small changes like snacking on nuts or seeds can contribute to daily fiber intake. Supplements can be used if these dietary changes aren't enough. But whole foods should always be the first choice because they provide other nutrients and benefits that supplements can't fully replicate. According to research, more than 90% of the adult population in the US doesn't consume adequate potassium, which is a huge problem since potassium is essential for regulating blood pressure, maintaining proper heart rhythm, and balancing fluid levels in the body. For seniors, this deficiency is even more concerning because blood pressure tends to rise with age, and the risk of cardiovascular events like heart attacks and strokes increases. Potassium works hand in hand with sodium to relax blood vessel walls and prevent hypertension, making it a critical nutrient for heart health. Insufficient potassium intake has been linked to higher blood pressure, increased arterial stiffness, and greater risk of stroke and heart disease. Studies show that diets rich in potassium, especially when paired with lower sodium intake, can significantly reduce both systolic and diastolic blood pressure. In fact, the American Heart Association recommends increasing potassium intake through foods as a key strategy for preventing hypertension and reducing cardiovascular risk. When it comes to boosting your potassium intake, it's generally better to focus on low-carb, low-sugar sources like avocados, leafy greens, spinach, and broccoli, rather than higher sugar options like bananas. These choices give you the potassium your body needs without spiking blood sugar. However, before significantly increasing potassium intake, especially through supplements, it's important to make sure your kidneys are functioning properly, because impaired kidney function can prevent the body from excreting excess potassium, which can be dangerous and even lead to serious heart problems. The good news is that with careful dietary choices, seniors can safely raise their potassium levels, lower blood pressure, support healthy heart rhythm, and reduce the risk of heart attacks and strokes, all while enjoying nutrient-rich whole foods. I bet you saw vitamin D coming, and for good reason. It's one of the nutrients that many seniors don't get enough of, yet it plays a critical role in heart health, bone strength, and immune function. As we age, our skin becomes less efficient at producing vitamin D from sunlight, and many older adults spend less time outdoors. On top of that, few foods naturally contain enough vitamin D, making deficiency surprisingly common. Vitamin D is essential for regulating calcium and phosphate levels, which affects not just bones, but also the cardiovascular system. Low levels of vitamin D have been linked to higher blood pressure, increased risk of heart attack, stroke, and heart failure. Research published in the American Journal of Clinical Nutrition found that seniors with insufficient vitamin D had a significantly higher risk of developing cardiovascular disease compared to those with adequate levels. When it comes to maintaining optimal vitamin D levels, diet and sun exposure alone are very unlikely to be sufficient for most seniors. This is where high-quality vitamin D3 supplements come in. But it's important to take them paired with the right amount of vitamin K2, which helps direct calcium to bones and away from arteries. For those who are deficient, daily doses of 5,000 to 10,000 IU of vitamin D3 may be necessary, but it must always be paired with K2 and routine blood work to ensure calcium levels stay safe and to avoid stressing the heart or kidneys. You've probably heard that omega-3 fatty acids are good for your heart, but what many people don't realize is that a deficiency in omega-3s is incredibly common among seniors, and it could be silently increasing your risk of serious cardiovascular problems. Omega-3s, especially EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, are essential fats that help reduce inflammation, lower triglyceride levels, regulate blood pressure, and support a steady heart rhythm. These benefits aren't just theoretical. A 2021 study published in Nature Communications found that people with higher blood levels of omega-3s had a 13% lower risk of death from all causes, particularly from heart-related conditions. The American Heart Association also notes that omega-3s can lower the risk of fatal heart arrhythmias and reduce blood pressure in people with hypertension. Yet despite all this, most seniors don't get enough omega-3s, primarily because they're not consuming enough of the right foods. Unless you're eating fatty fish like wild-caught salmon, sardines, or mackerel at least 2 to 3 times per week, your omega-3 intake is likely too low. And while plant-based sources like flax seeds and chia seeds do contain ALA, alpha-linolenic acid, this form doesn't convert efficiently to EPA and DHA, the two forms that provide the strongest heart protective benefits. Whenever possible, it's always best to get your omega-3s from whole food sources, especially high-quality options like wild-caught salmon, sardines, anchovies, or mackerel. These not only deliver omega-3s in their most bioavailable form, but also come with additional heart-supportive nutrients like selenium, B12, and vitamin D. If your diet is low in these foods, a high-quality fish oil supplement can help, but not all supplements are created equal. Be sure to choose one that is molecularly distilled, third-party tested for purity, and free from heavy metals and contaminants. Just as important, check that it's not rancid. Oxidized fish oil can do more harm than good. If your capsules smell fishy, sour, or give you a strong aftertaste, they may already be oxidized and should be replaced. Of course, magnesium had to be on this list because it's one of the most important minerals for heart health, yet it's also one that many seniors are unknowingly deficient in. In fact, some studies suggest that up to 50% of older adults may not be getting enough magnesium, either from their diets or due to poor absorption related to age, medications, or digestive issues. Magnesium plays a central role in over 300 enzymatic processes in the body, but when it comes to the heart, it's absolutely critical for maintaining normal blood pressure, a steady heartbeat, proper nerve signaling, and smooth muscle relaxation in blood vessels. When magnesium levels are low, the blood vessels can constrict, the risk of hypertension increases, and the heart becomes more vulnerable to irregular rhythms, spasms, and even heart attacks. Multiple studies have shown a strong connection between low magnesium and higher risk of heart disease, sudden cardiac death, atrial fibrillation, and elevated blood pressure. One study published in the American Journal of Clinical Nutrition found that individuals with higher magnesium intake had significantly lower risk of ischemic heart disease and stroke compared to those with low intake. What's more, magnesium also helps to balance other critical electrolytes like potassium and calcium. This balance is essential for keeping your heartbeat regular and your blood pressure stable. Without enough magnesium, calcium can build up in arteries, contributing to arterial calcification, a known risk factor for heart attacks and strokes. Another often overlooked benefit is magnesium's role in blood sugar regulation. For seniors with insulin resistance or type 2 diabetes, both of which significantly raise cardiovascular risk, magnesium can improve insulin sensitivity and reduce inflammation, offering both heart and metabolic protection. Now, when it comes to improving your magnesium levels, food should always come first. Magnesium-rich foods include dark leafy greens, pumpkin seeds, almonds, cashews, avocados, legumes, and whole grains. However, modern soil depletion and food processing have stripped much of the magnesium content from our diets, so even if you eat well, you still might not be getting enough. That's why many seniors may benefit from a high-quality magnesium supplement, especially forms like magnesium glycinate or magnesium taurate, which are known for being gentle on the stomach and more absorbable than cheaper forms like magnesium oxide. Just remember, not all supplements are created equal. Look for a clean product without unnecessary fillers like magnesium stearate or microcrystalline cellulose, and always check the elemental magnesium amount listed per serving, not just the total compound weight. So there you have it, 5 critical nutrients that most seniors are missing out on, and every one of them plays a powerful role in keeping your heart strong, your blood pressure stable, and your risk of heart disease low. Neglecting these nutrients doesn't just affect how you feel today, it shapes your long-term health, your independence, and your ability to enjoy life as you age. But the good news is, these deficiencies are fixable. With the right foods, smart supplementation, and a little awareness, you can take control of your heart health, starting right now. And remember, before adding any new supplement to your routine, especially if you're on medication or managing a health condition, please speak with your healthcare provider first. If you found this video helpful, give it a thumbs up, share it with someone who needs to see it, and don't forget to subscribe for more life-changing health content every week. Thanks for watching, and see you in the next one.